In 2012, I spent 3.5 weeks in the hospital on high doses of diloted, and when I was sent home from the hospital, I was given a prescription for pain medication. At the time, I was weaned off of the dilaudid in the hospital too fast and didn't know what was going on when I went through extreme withdrawal. I thought I was dying. I thought I had another bowel perforation because that was what had landed me in the hospital. And the pain was very similar because what happens when you come off of dilautids, which is what I was on, is your intestines spasm and cramp. And I'd been having spasming and cramping intestines from the bowel perforation. So it was so similar and the pain was so intense. I honestly thought I had another bowel perforation and I was dying. This is when I was in the hospital. I said, I'm in so much pain. I'm in so much pain. So then they increased my pain meds. And guess what? The pain went away and they checked me and there was no bowel perforation. All I knew is that the pain was gone and I was happy. But when they sent me home, just a few days or a week after they sent me home, my dilaudid prescription ran out and I again went into withdrawal without knowing it. And I was so sick and in so much pain and was sure that I had another bowel perforation that I was going to the hospital over and over. So for the week before Christmas, the few days leading up, 3 days leading up, I was in the hospital every single day saying, I'm in so much pain, I'm in so much pain, please help me with the pain. They gave me everything for pain except dilaudid. I kept going, now I'm going back, I'm like, listen, please, just give me dilaudid. It's the only thing that takes my pain away. I don't know why, but all this other shit you're giving me doesn't work. Still, I had no idea that I was going through withdrawal. So, finally, Christmas Eve, I'm in the hospital. It's like midnight. All I want is to be able to get up the next morning and watch my children open their presents and spend Christmas morning with them. It's been a horrendous month for us, a few months. It's been a horrendous week for us. And I'm at the hospital and I'm begging the doctors to help me. And they still are only offering me Toradol or something like that. Finally, I said, listen, I'm crying. I'm hysterical. I'm like, I think 80 pounds or less because I was only like 95 pounds when I got sick. And after losing like 20 pounds in the hospital, I was like skeleton, walking skeleton, skin and bones. And they were treating me like I was a drug addict off the street seeking drugs, which I feel sorry for people who are off the street, how they get treated. It's disgusting. But I had been an advocate for myself for quite a while at this point. So I thought to myself, there must be someone who can help me here in the hospital. And I said to them, do you have an advocate? Is there an advocate here? I want to talk to an advocate. And so finally a social worker is brought to me into emergency and I sit down and I tell her, and I hate that I had to do this, but I had to say, I'm a manager of communications and I'm a mother of 3 and I'm not a drug addict and these doctors are not taking me seriously and all I want to do is be able to be present for my children tomorrow morning on Christmas morning. And so she advocated for me and they finally gave me some dilautids. And now all of this was a big problem because at the time my doctor was out of town. Otherwise my doctor would have helped me. But if you know anything about dilautids, it's hard to get them from anyone but your own doctor, and only certain doctors can prescribe it. Anyway, it's a real runaround. So here I was, I still did not know that my body was dependent on this drug, dilaudid. I still thought I was in pain from my surgery. I had no idea that I was going through withdrawal. Christmas, they finally give me dilaudid. I go home, I take some, I go to bed. I'm up every few hours puking. I'm still sick. All through Christmas morning, I don't get to watch my kids open their presents. It still hurts remembering. Feeling so angry and guilty that I couldn't bring the strength to get out of my bed and watch my kids open their presents. So as I started to feel better from that experience, I was lying in bed on my phone and I wanted to research diloted, because I was like, why does diloted work for my pain, but none of the other drugs that the doctors would give me? And so I start researching, and that's how I found out that I was going through withdrawal, because all of my symptoms were withdrawal symptoms. And no doctor, up to this point, after multiple hospital visits, after they cut my meds in the hospital during my 3.5-week stay while I was still there and I went through withdrawal, none of them recognized withdrawal. None of them told me what I was going through. None of them, explained why they were treating me like a drug addict. Nothing. There was just no explanation. Okay. So that was 2012. Now we're in 2024, and that's happened to me because I've been hospitalized multiple times over the years since then with issues related to my bowels. And even most recently in September 2023, I had a major operation. I was put on diloted for the pain, and I was in the hospital for a week. And when I was in the hospital, they cut my diloted without telling me, and I went through withdrawal. And they told me to my face that only drug addicts, people who are engaging in regular drug addictive behaviors, which I wasn't doing, would go through withdrawal from diloted that soon after being put on it. And I said, but I've been on it before and my body knows it. And I've heard that, this happens, that this is what happens. And I had multiple pain medication doctors stand at the foot of my bed and assure me that I was not going through withdrawal. However, they did raise my meds enough, and because I'd been through this so many times before, I actually smuggled some diloted into the hospital in case they did this to me. And so I was sneaking it privately to get my dose back up so that I could be well again. And when I got out of the hospital, of course, I went to my doctor and we worked out a plan for me to wean off of it. You have to wean off of diloted. And another thing I found is that pharmacists and doctors don't know how you're supposed to wean off it. They tell you to skip every other dose. Well, that doesn't work for everyone. For me, I had to actually just cut down every other dose really slowly over 3 days, and then another 3 days at a lower dose, and then another 3 days, but at least take a little bit of diloted at every scheduled dosing time to get me through, because otherwise I would go through horrible withdrawal. Anyway, the whole point of this rant and this story and this explanation is because we're in 2024. I have a friend struggling with terminal cancer, and he had a shotgun wedding to marry the love of his life. Is so excited to spend his last days with her, and his pain nurse cut his meds without telling him. And so he's been suffering instead of spending his last days enjoying them. And the pain nurse and her boss are all trying to, intimidate him. And what is with health professionals and their God complex? It's not just doctors. It's nurses too. I feel like you shouldn't be allowed to be a pain nurse unless you've ever experienced withdrawal. That should be a rule. I got hired working in transition houses because of my life experience and because of my experience growing up poor, having addiction in my family, being Indigenous, and being a sex worker. Those things were valued, and that's why people hired me to work in transition houses, because I was more empathetic and understanding and caring to the people, the membership that or clients that we provided services for. But they don't do that in hospitals. No, they pick these people who have no understanding, no experience, and they stand there looking down their noses at you and making you feel like you're a drug addict, drug-seeking piece of shit, which this is not my words. I do not think that people who do drugs are pieces of shit. But this is how nurses and doctors will make you feel. You're suffering, you're at the lowest of your low, and you're going through withdrawal, and you feel like you're fucking dying, and nurses and doctors will tell you, no, you're not going through withdrawal. And if you are wanting drugs this bad, then maybe you need drug treatment. And that, I had to be investigated in September before they would allow me to have my meds and go home with my meds, just because I told them that they made me go through withdrawal. Yeah. So because they made a mistake, I was the one who was put under a microscope and treated like I was the one who was messed up. This is a problem in our medical system, and it really bugs me. Our medical system is so broken, I highly doubt they're going to get to this anytime soon. But I really feel like they should, that this should be something they should study. Like, they should contact all of us who've been in the hospital, in Surrey Memorial Hospital, in the last, 2012? 14 years. That's when it started for me. So I know they've been doing it for 14 years in Surrey Memorial Hospital. And contact everyone they've put on diloted and ask them, did you go through withdrawal? Did the nurses tell you about withdrawal? Did they cut down your meds without telling you? And did you suddenly feel incredibly sick and like you were dying? Like, how many people have been through this? If I've been through it at least 4 times that I remember, if not more, and I have a friend that's going through it right now, I have a feeling it happens a lot. What's your story? Has it happened to you? Please share.